So today we're going to go through a couple tests and challenges you can do by yourself at home to assess your ability to balance. So a quick balance screen we can do at home is the 4-stage balance test. It's a series of 4 positions, each harder than the last, to test your ability to balance with a narrow base of support. Before doing the test, set yourself up near something where you can hold on if you need to, but we're going to try not to touch just so you don't fall. The first position, we're going to start with the feet together as close as they can touching. You can stay there for 10 seconds. If you can hold that position for 10 seconds, we're going to get a semi-tandem stance, which is where the toes of one foot are lined up with the arch of the other, and we're going to hold that for 10 seconds. If we can hold that for 10 seconds, we're going to go into a full tandem stance where we're going full heel toe with the toes lined up straight, without the foot angled in or out. You're going to hold that for 10 seconds. If we can hold that position, we're going to go into a full single leg stance and maintain that for 10 seconds. One way we can test our balance in single leg stance combined with a lateral movement would be a skater hop. So we're going to start with some really small hops, jumping off of one leg and landing on the other, really trying to stick that landing and minimize any wobble side to side before we jump again. If we can hold that position fairly easily, we can start to go wider with our hops. This is a really important drill where we want to be able to push off laterally on one side and accept all that force on the other side while staying stable. This is important for any movements where we're doing heavy lateral movements and spending a lot of time on one leg. Good examples of this would be like skiing or skating on ice. A balance screen we can do at home to test our ability to balance without visual and proprioceptive feedback is the Romberg test. Proprioception is just your body's ability to sense where it is in space. So the first part of this test is to stand with your feet together, with your eyes open, and hold that position for 10 to 20 seconds. If we can do that easily, we're going to close our eyes and take away some visual feedback. We're going to hold that for 10 to 20 seconds. To challenge your body's ability to position itself in space and sense that position in space, we can use a soft surface. We're going to use the AirX pad here, but at home a folded up towel or pillow, folded up thick blanket would be fine. We're going to stand on that with our feet together and our eyes open. We're going to hold that position for 10 to 20 seconds. If we can do that easily, we're going to close our eyes and take away both visual feedback and make it hard for our body to sense where it is in space and hold that for 10 to 20 seconds. A good way to assess your balance at home is to see if you can pick something up off the floor in a few different positions. So this is going to challenge your ability to stabilize yourself as you're weight shifting and reaching and doing something with your arms. So the easiest way to start is to just stand in front of something on the floor. We're going to use this yoga block here, but a shoe or slipper on the floor would work just as fine. And you want to bend forwards and pick it up off the floor. If that's easy, we can make it a little bit harder by doing what we call the golfer's lift, by going on one leg and reaching down. Imagine you're taking a golf ball out of a hole and coming up. If that's easy, another challenge would be to stand on one leg and take the shoe on your other leg off and put it back on without touching the other foot to the ground. If you found that you weren't able to do any of these challenges or positions or struggled with them, that indicates you might have a problem coordinating the muscles and joints of your foot, ankle, knee, and hip, even all the way up to your core, and that puts you at increased risk for a fall potentially. The reason we don't want to fall is, first of all, it's not fun, but also the injuries and inactivity related to falls can put you at risk for a lot of other health conditions. So if you found that you weren't confident or weren't able to do any of these things, give us a call, come see a physical therapist. We'll give you a personalized treatment plan to help address any issues that you have and even help decrease your apprehension and fear of falling so you can be confident, do the activities that you like, and have a strong, healthy, happy 2024.